Yeah, hi, my name is Anson. I'm one of the dietitians here at Annenbrooks Hospital. So I'm currently head and neck oncology dietitian. And what got me into the role was someone important to me had cancer, and I wanted to find a role where I could help people in a similar situation in the future. Yeah. Yeah, so my main role is making sure patients are well optimized nutritionally throughout the entire cancer journey, from the start of treatment to before they're being diagnosed, and then after they receive their treatment, just to make sure they're well nourished throughout the entire journey. So we see them initially when they come into clinic, and then we meet them regularly. We give them phone calls, we see them face to face, and then we also follow them up if they come into hospital, just to make sure they receive any support that they require. Yeah, so last year one of our patients got referred to us who needed surgical treatment for his cancer. But because he wasn't fit enough, we supported him with nutrition, and that allowed him to get all the nutrition he needs, and then he was able to successfully have his surgery, and now he's also having radiotherapy now. Yeah, I think something which is most quite difficult is when we go see our patients. They're often quite difficult time already, just because that's when they receive their diagnosis or receive a lot of input from other medical staff. So this can be quite an overwhelming situation. So we have to try to balance between giving our input and also not making sure they're not too overwhelmed. But what I find most satisfying myself is when I can give a patient adequate support, and then they're able to self-manage at home. So when patients are able to be self-empowered, that's quite rewarding to me. In my role, we work quite closely with speech and language therapists. So because patients often have some difficulty swallowing, either from their treatment or just from the cancer, so we work closely together to make sure they receive adequate and safe recommendations for the swallowing, in terms of what's safe to eat and what's safe to drink, and then offer nutrition advice that is safe as well. I think something that is quite misunderstood is that dietitians can be seen as someone just gives people a lot of information, but I guess I want to let people know that we try to take a more holistic approach and often try to listen to patients, and then we're often quite patient-led. So when patients tell us how they're feeling or their thoughts or opinions, things, we take that very seriously, and we adapt the plan to make sure everyone is happy.